Cat owners don't want their cats to feel pain. But because cats can't talk to us when something's wrong, it's our job to notice the signs they show us. If you're not sure what to look for, don't worry. Here are 20 warning signs that your cat is crying for help. Number 20. Hiding more. Cats usually like to hide, but if your cat is hiding more often than usual, it might mean they're in pain. Cats that start hiding suddenly might be stressed or have a hidden sickness bothering them. Number 19. Avoiding the litter box. If your cat has always used their litter box and then starts going to the bathroom in random places around the house, it could be a sign they're feeling unwell. Health problems like urinary tract infections, kidney disease, and bladder stones can cause these litter box issues. Number 18. Discolored gums. Normally, your cat's gums should be a deep pink color. When you press them with your finger, they should turn pink again within a few seconds. If the color doesn't come back quickly, it might mean your cat is losing blood or has poor circulation. The pink color of gums comes from blood flowing underneath. Bluish gums could mean your cat isn't getting enough oxygen, which is very serious. Bright red gums might indicate toxicity or overheating, but if the redness is right above the teeth, it could be a dental issue. Number 17. Bad breath. If your cat's breath smells unusually bad, it could be a sign of gum disease or tooth decay. A cat's teeth have lots of bacteria, but you can reduce the risks by brushing their teeth and getting them a dental cleaning once a year. Number 16. Drinking a lot. If you see your cat drinking a ton of water compared to usual, it might mean something's up. Cats normally don't drink a whole bunch, so it's usually easy to tell if their water bowl empties faster. Drinking a lot could mean your cat has a problem with their hormones, like diabetes or hypothyroid disease. It could also signal kidney issues, which often show up in older cats, but can happen earlier too. Number 15. Changes in maintenance practices. Cats are excellent at keeping their physical look. When a cat disregards his regular grooming regimen, it may be time for a checkup. Your cat might suffer from various diseases that induce weariness, explaining its unkempt appearance or lack of grooming habits. A disheveled cat may have missing fur patches, unclean ears, excrement attached to its rear end, or garbage trapped in its fur. Number 14. Eating more suddenly. Most people worry when their pet stops eating, but if your cat starts eating a lot more all of a sudden, that could also mean they're sick. Increased appetite might mean your cat has health issues and needs to see a vet. It could be due to diabetes, hyperthyroidism, or problems absorbing nutrients. Number 13. Crying or yowling. If your cat cries or yells, it could mean they're in pain. If you try to pet them and they whine or stay away from you, something's up. Number 12. Vomiting. Some people think it's normal for a cat to throw up once a week, but it's not. While vomiting a few times a year or coughing up a hairball is normal, throwing up once a week could mean your pet is sick. Number 11. Increased aggression. When a cat's behavior suddenly changes, it could mean they're sick. A cat in pain might become aggressive, especially if you accidentally touch a sore spot. Number 10. Losing hair and crusty skin. If you notice your cat losing a lot of hair and having crusty or scaly patches on their skin that look red, you should take them to the vet. Too much hair loss could mean they have a skin disease, lack certain vitamins, have allergies, or are really stressed out. Sometimes these are signs of ringworm, so it's important to have your cat checked by a vet. Number 9. Unexpected weight changes. If your cat suddenly gains or loses weight for no clear reason, it's important to see a vet. Cats' bodies work differently from humans, so a change of just 1 pound for a cat is like a human gaining or losing 10 pounds. Pay attention to even small changes in your pet's weight. In older cats, some weight loss might be normal as they lose muscle mass, but big changes could mean something serious, like cancer. Number 8. Loss of appetite. If your cat stops eating their favorite treats all of a sudden, take notice. It could be a sign of a serious infection, kidney issues, fever, or even cancer. Number 7. Mobility issues. If your cat seems stiff or is limping, something might be wrong, especially if they're young. In older cats, it could mean arthritis. Number 6. Changes in sleeping patterns. If your cat starts sleeping all day when they used to be active, they might not be feeling well. On the other hand, if they're suddenly active at night or excessively vocal during the day, it could also signal a problem. Number 5. Coughing. Cats can cough for different reasons like allergies, hairballs, or asthma, which aren't usually serious. But it can also signal more severe issues like heart or lung disease, contagious diseases, or respiratory problems like bronchitis. If your cat keeps coughing for more than a day, don't wait. Contact your vet. Number 4. Watery eyes and nose sneezing. Discharge from the nose or eyes, fever, coughing, and sniffles are all symptoms of upper respiratory tract illness in cats. This is roughly the same as a regular human cold. Excessively runny eyes or a clear discharge from the eyes, on the other hand, might indicate eye discomfort or a blocked tear duct. Green or yellow discharge usually means an infection that needs treatment from a local veterinarian. If, on the other hand, your cat's eyes are red and runny, they may have conjunctivitis. In other words, they may have dust allergies, infections, or other allergies that can cause pink eye in cats. The condition may worsen because of feline herpes. Number 3. Bloody urine, stool, or vomit. Blood in your cat's urine might mean a urinary tract disorder, while blood in stool could signal various illnesses, from minor to severe, like parasitic infections. Blood in vomit always needs immediate attention from a vet, as it usually indicates a serious problem. Number 2. Struggling to use the bathroom. If your cat tries to go potty but can't, they might have a blockage, which can be life-threatening if not treated, especially if they're in pain while trying to go. Number 1. A lump or unusual growth. Lumps or bumps may be perfectly harmless, but without an examination, it is impossible to tell. Even if the new growth is benign, it can develop on an area that causes discomfort for your pet. Generally, cats are creatures of routine by instinct and love to follow a pattern. So as a feline guardian, you must observe your feline closely and know his routine and how he usually behaves in different situations. When a cat doesn't feel good, is ill, or is stressed, the first indication is a change in his routine or expected behavior. So if you know your cat's routine, you can spot any difference immediately.